Lyme disease. Signs and symptoms. In many cases, Lyme disease does not indicate that it's a very serious condition, but I'm here to red flag the things you want to look for to know if you've actually been contracting Lyme disease. So as we can see here, Lyme disease symptoms are early signs are 3 to 30 days after a bite, and you will have a fever, chills, headache is present, and fatigue. Still, all these symptoms basically are mimicking a mild flu, but you can't consider that it's just a flu, especially if you know you've been contacted with a bite from a tick. Being bit by a tick does not mean you'll get Lyme disease because they must carry that bacteria as well. But the chances are that if you've been bit by a tick and you have these symptoms, you might have Lyme disease at that point. Later signs become facial palsy, where you basically have sporadic muscle contractions while you try to speak. This also affects the cardiac system. Could actually present as a irregular heartbeat, palpitations, all the way to an actual, myocardial infarction. And dizziness. Dizziness, because this bacteria is known to pass through the blood-brain barrier, and so it can actually start to cause problems in your brain and your neurological system. Bullseye. This is a point of contention because not everybody will have the bullseye if they have Lyme disease. The migraine erythema is not always present with Lyme disease, but it is one of the polymnemonic symptoms that does indicate that Lyme disease is present. But it doesn't eliminate the possibility of Lyme disease if the absence of this bullseye is not present. Okay, so we have the red flag symptoms. These are the things that you want to use caution with and that you need to really seek medical care if you have these symptoms. So a fever that's above 39 degrees Celsius or 102.2 degrees Fahrenheit that doesn't improve with fever reducers such as anti-inflammatories or antipyretics. An acute headache, neck pain, or photophobia that may suggest meningitis. Again, this would be a side effect of the bacteria invading certain parts of the body, and photophobia, as in meningitis, could be part of that. Cardiac symptoms such as palpitations, syncope, or an abnormal heart rhythm on an ECG. A rash that's spreading rapidly with a clearing in the center and associated with symptoms such as the migraine erythema. Again, it doesn't have to have this, but you're looking for this. These are things that really tell you for sure you do have Lyme disease. Facial drooping or weakness, because this can affect the neurological systems and the muscular system. It's a symptom of cranial nerve palsy, and it can also cause joint swelling and make it difficult to walk, or you have significant pain, just new pain that you don't usually have. It can sometimes be confused with rheumatoid arthritis or osteoarthritis. But again, if you've been bitten by a tick and you've never had these other symptoms before, it's quite reasonable to believe that this is being caused by a bacteria that was transmitted by that tick. So once again, the red flag symptoms. My goal here with this presentation was that you would hear repetition of these symptoms and what to look for, so that I could instill into you how important it is that you look for these symptoms. As it says, if any of these symptoms are present, urgent consultation, emergency department evaluation, or hospitalization may be necessary. And we're going to start here with heart problems. In some cases, Lyme disease can affect heart function, causing abnormal heart rhythms, dizziness, and even fainting. Facial paralysis. If you experience paralysis or numbness in your face, you should get to an emergency room as soon as possible. Weakness or paralysis in your limbs. Limb weakness or paralysis or numbness and tingling could be signs of meningitis or encephalitis. There's the example of crossing the blood-brain barrier. Confusion or difficulty speaking, changes to your mental state and speech patterns can also be signs of meningitis or encephalitis. So you can see that there's Lyme disease, but the bacteria just caught Lyme disease. It can cause other diagnostic differentials as well. So Lyme disease has 3 stages. There's early localized, early disseminated, and late disseminated. Early localized, basically the bacteria can be confined to the lungs as a primary pulmonary fungus, and only 60% usually do not experience any symptoms. The patient will experience flu-like illness, which includes fever, cough, headache, muscle aches, and tiredness. Stage 1 Lyme disease manifests itself in 3 to 30 days after a tick bite with the bullseye erythema migrans, a circular red skin lesion that can resemble a bullseye. EM is the defining sign of the infection, but might be absent or misdiagnosed. Early disseminated Lyme disease stage 2 occurs weeks to months after a tick bite and spreading the infection to the nervous system. The heart, joints, symptoms include multiple rashes, severe headaches, stiff neck, facial palsy, heart palpitations, numbness, tingling, and there you will also experience fatigue and pain. And the solution for this is antibiotic treatment. Okay, so what causes Lyme disease? What's the pathology? Okay, well, Borrelia bacteria is the main cause of Lyme disease, and what it does, it attacks several mechanisms. These mechanisms, as it says right here, inducing inflammation by triggering immune cells, which damages tissues, altering immune cells to evade the immune response. So basically what it has done is it's reduced the ability of immune cells to recognize antigens. Because they can't recognize antigens, that weakens the immune system, and therefore it makes this bacteria very effective at doing the damage that it does to the body. It interacts with the endothelial cells to facilitate spread. Endothelial cells are found throughout the body, so it makes it an excellent highway for this to spread throughout the body, through the nervous system, muscular system, the skin system, everything you can think of. Endothelial cells are found in the stomach. They're found all throughout the body, okay? These invading tissues using surface proteins, okay? So basically it confuses the surface proteins not to recognize what's going on. And then it indirectly disrupting cell function through inflammation, leading to cell death. Okay, so what causes Lyme disease? What's the pathology? Okay, well, Borrelia burgdorferi bacteria is the main cause of Lyme disease, and what it does, it attacks several mechanisms. These mechanisms inducing inflammation by triggering immune cells, which damages tissues, altering immune cells to evade the immune response. So basically what it has done is it's reduced the ability of immune cells to recognize antigen. Because they can't recognize antigens, that weakens the immune system, and therefore it makes this bacteria very effective at doing the damage that it does to the body. It interacts with the endothelial cells to facilitate spread. Endothelial cells are found throughout the body, so it makes it an excellent highway for this to spread throughout the body, through the nervous system, muscular system, the skin system, and the stomach. They're found all throughout the body, okay? These invading tissues using surface proteins confuses the surface proteins not to recognize what's going on. It indirectly disrupting cell function through inflammation, leading to cell death. So to conclude, use caution. Don't take this possible disease lightly, because it can cause irreparable damage to your system and actually result in death. It has multiple prongs of affecting certain areas of the body and mimicking other diagnostic differentials. So, as it says right here, potentially leading to severe chronic complications like arthritis, heart disease, and neurological issues. This presentation focuses on identifying Lyme disease symptoms that warrant medical attention and treatment. And I emphasize treatment as an immediate need. I thank you for listening to this presentation. The next slide will indicate the references I used to develop this presentation. Thank you very much.